This is Sadeer Hannush from the Cornea Service at Wills Eye Hospital in Philadelphia, describing a simplified technique of performing the Yamane procedure for intrascleral haptic fixation of a 3-piece intraocular lens implant in the absence of capsular support. Professor Michael Amon from Austria developed this device with the help of Goiter in Germany. It is basically a 27 or 30 gauge needle with an integrated micrograsping forceps embedded in the lumen of the needle, which comes out to grab the haptic of the IOL and exteriorize it out of the eye. What you see here is the device. When the handle is actuated, the microforceps comes out of the needle, grasps the haptic, and then brings it into the needle lumen. So in the Yamane technique, you can see here as the needle enters the eye, the actuation process is started, the grasper comes out, grasps the haptic, and guides it into the lumen of the needle. Here's an eye with a posteriorly displaced intraocular lens implant. After placing the surgical marks on the eye, we will perform a 3-port preparation for a vitrectomy, first with the infusion cannula and then placement of a vitrectomy lens. The vitrectomy cutter is used to deliver the IOL into the anterior chamber, as you see here. And after delivery of the entire IOL into the anterior chamber, it is bisected. We perform a subtotal bisection with a pair of scissors and then gently rotate the IOL to dial it out of the eye with the residual Summering's ring. We are now prepared to deliver the new implant. Here is the device actuated with the microforceps coming out of the needle. The needle is inserted into the eye in the usual fashion with a 2mm traverse, and then behind the pupil, you see me here grasping the haptic after actuation of the microforceps, gently guiding it into the needle lumen and exteriorizing it out of the eye. The haptic end is then flanged with cautery and reinserted into the scleral tunnel. This is done on both sides of the limbus, obviously, followed by 2 iridectomies using the 25 gauge cutter to prevent reverse pupillary block, a known phenomenon with these procedures. Here we are with another displaced intraocular lens implant with a dense Summering's ring, again showing actuation of the handle with the microgasper coming out of the needle. It's inserted into the eye and used to deliver the haptic out of the eye. Iridectomies are placed and the procedure is terminated. So again, a simplification of Professor Yamane's procedure that he described in 2016, making it easier for surgeons to perform this technique for intrascleral haptic fixation. Thank you for your attention.